May is Better Hearing Month, and that means protecting your ears and helping your kids keep their ears protected as well. We're joined this morning by Dr. Douglas Anderson and Laurel Brewer, an audiologist with the Ogden Clinic, to get some answers on some very common questions in this sponsored segment. Good morning to both of you. Thanks for being here with us.
Thank you. Appreciate it.
So when we're talking about speech and hearing problems, it can really create other issues in life as well. Very important issue here, so let's start off with that. What are those?
Well, some of the problems that you can have if you have speech and hearing issues is it can affect your ability to in your workplace, as far as how well you do, how well you function interact with other employees. It can affect you in school, and that's really important with kids as they're growing up and trying to keep up with their classmates. And so identifying speech and hearing problems is critical, especially in the young group.
Sure. So that can really go on to many different areas of life.
Yes.
When we're talking about these types of problems, age, gender, are there more common problems with those two areas?
You know, I think age and gender, different things can affect hearing loss. Hearing loss can affect at any age. There are some different kinds of hearing loss that can affect women. We see men having more noise-induced hearing loss because they work in noisier environments, but I think women are out in the workforce now too, working in those noisier environments, so you're going to see more women with that. There's a condition called otosclerosis that tends to affect women more, and that's a stiffening of those middle ear bones, and that can affect hearing loss usually around your childbearing age is when women might start noticing a change in hearing, and that's important to check into.
A lot of times it can be a parent that can discover these types of issues. So what signs should parents be looking for when we're talking about this?
Well, when we learn language by listening, so if you're not able to hear, then there may be a speech delay. So if you notice that your child is hard to understand, omitting sounds from their speech, needing the television louder, or saying what a lot, that's a sign that there might be a problem.
And then what should you do in that situation?
Well, I think it definitely what it means is you need to get them in to be evaluated. Again, because, so let's say they're not hearing very well for a couple of weeks, but if it's something that's sort of ongoing for longer periods of time, you don't want them to get behind in their school. So with kids, it's especially important that if you notice that, like Laurel said, that they're maybe not responding very well, if you're talking to them, maybe they're looking away, they don't seem to hear you, or the TV's up loud, then you want to get them in to be evaluated so that that problem can be addressed. It may be simple, just like wax, maybe fluid behind the eardrums, but you want to get them in to be treated, because something could be that could be very simple to fix.
What are some simple tips parents should know about taking care of their children in this area? Q-tips would be something that a lot of people will stick in their ear to clean it out. Right. Is that a good thing to be doing?
That's a great question. There's an old wives' tale that says we shouldn't put anything in our ears that's smaller than our elbows. So Q-tips would definitely not be something we want to put in there. And the reason why...
good luck fitting your elbow in
exactly.
there, right?
Because Q-tips, even though everyone uses them, they really can cause trauma to the ear canal. Probably a couple times a year we see perforated eardrums from Q-tips, but they frequently cause little micro abrasions in the ear canal, which can make them prone to ear infections. But often they end up impacting the wax, pushing it deeper into the ear canal instead of cleaning it out. So we say avoid Q-tips for deep in the ear.
Okay, what else can parents do to help protect their children?
I think just knowing what to watch for, to know that if they're not hearing well, if the TV is up loud, maybe just having those ears checked if there's any kind of issues with speech, if they're not understanding. A lot of parents can understand their children, but other people will have a hard time understanding them. And so if other people are struggling to understand those words, it's maybe time to have that hearing checked, because even if it's a speech delay, a speech pathologist will want a hearing test too to see if hearing can be the cause.
All right, great to have both of you here. Thanks for being here. Some very helpful tips. Thank you.
Thank you so much. Appreciate it.
If you'd like to learn more about hearing or to book an appointment with the Ogden Clinic, just head over to our website, goodforutah.com/midday.
Thank you, Glenn. Now coming up, where do you keep...